Hello, my name is Andrea. I'm with the Healthcare Provider and Return to Work Outreach Team at the Texas Department of Insurance Division of Workers' Compensation. Thank you so much for being here today as we go over the healthcare provider roles and responsibilities in the Texas workers' compensation system. Today we'll be going over some important definitions related to healthcare providers and their roles, qualifications of healthcare providers in the workers' compensation system in Texas, the different doctor roles, as well as the responsibilities of other healthcare providers in the system. To start off with, let's look at our healthcare provider requirements. The term healthcare provider in workers' compensation refers to both individuals and facilities. Specifically, a healthcare facility includes hospitals, emergency clinics, outpatient clinics, and other facilities that provide care, while a healthcare practitioner in workers' compensation is an individual. It includes not just licensed individuals providing care, but also non-licensed individuals who work under a doctor's supervision. And these definitions are outlined in Section 401.011 of the Texas Labor Code. To participate in the workers' compensation system, healthcare practitioners must meet some essential requirements. First, they must have an active medical license in Texas or in their jurisdiction. If they're unlicensed, they can still participate, but only under the supervision of a licensed healthcare provider. In Texas, practitioners also need to file a financial disclosure with the Division of Workers' Compensation. Also, our doctors can't have any disciplinary orders that would restrict their ability to work within the system. And these requirements help ensure that practitioners are certified and compliant with the system standards. Financial disclosure is all about ensuring transparency and preventing healthcare practitioners from making unnecessary referrals to providers that they have a financial interest in. And this helps ensure that any referrals to associated entities are appropriate and ethical. Financial disclosures also applies to compensation arrangements. This includes any payment arrangements between a healthcare practitioner or their immediate family and a healthcare provider. Practitioners need to file a financial disclosure with the DWC if they refer an employee to a provider that they have a financial interest in. This must be done within 30 days of the initial referral unless it was already disclosed. So if you're looking for more details, the division has a website with examples and instructions on how to file financial disclosure information in our TexComp system online. The DWC is responsible for overseeing the workers' compensation system and making sure everyone, including healthcare providers, comply with our regulations. If any non-compliance is discovered, the division can impose penalties, which can include restricting providers from treating workers' compensation patients. And there's a list of healthcare providers with restrictions available on the division's website. While these providers may still be able to practice, these restrictions might limit certain services that they can provide. For example, one common restriction is not being allowed to serve as a designated doctor. These are our doctors who are specially trained to perform exams and help resolve disputes in our system. Any doctor removed or denied from the approved doctor list that the Division of Workers' Compensation had a long time ago is still not able to practice in the workers' compensation system in Texas unless the commissioner says otherwise. Remember, we no longer have an approved doctor list. It was in place for a short amount of time, but currently there is no approved doctors list. So let's dig into the specifics of each doctor role. First, there's our treating doctor. This is the doctor who is primarily responsible for coordinating treatment related to an injured employee's compensable injury. And you want to think of this doctor as the gatekeeper of the injured employee's treatment. The first doctor who provides care to an injured employee is considered the employee's initial choice of treating doctor, although that's not always the case. And we're going to get into that a little bit deeper into the presentation. Next, we have the referral doctor. This is the doctor who steps in to examine and treat the injured employee. at the request of the treating doctor. Then there's the consulting doctor. This doctor examines the injured employee or reviews their medical records at the request of the treating doctor, a designated doctor, or even the DWC itself. The designated doctor does not treat, they don't have any prior relationship with the injured employee. They're assigned and specially trained by the division to examine the injured employee when they have reached their date of maximum medical improvement, impairment rating, or whether they have a disability or they can return to work, any other issues associated with the claim. And these doctors can be requested by the insurance carrier, the injured employee, or upon the request of the commissioner. The required medical exam doctor doesn't treat. They evaluate the injured employee's condition at the request of the insurance carrier or the division, though it's usually the insurance carrier who requests this exam. They are most often asked to give their opinion on issues such as maximum medical improvement, the injured employee's impairment rating. They also are going to usually take place after the injured employee has been examined by a designated doctor. Lastly, there's the peer review or utilization review doctor, and this doctor doesn't treat. They're performing an administrative review of the injured employee's medical records at the insurance company's request. Again, without physically examining the injured employee. And they must have no known conflicts of interest with the employee or the healthcare provider whose care is under review. So that summarizes the different roles that doctors can have in the system. According to the Texas Labor Code, Section 401.011, a doctor is defined as a licensed and authorized doctor of medicine, osteopathic medicine, optometry, dentistry, podiatry, or chiropractic. And to practice in Texas, they must hold a valid Texas medical license. Other practitioners, like physician assistants and nurse practitioners, can treat injured employees, but they don't meet the legal definition of a doctor under the Texas statute, and they can't officially be assigned as the treating doctor. While many healthcare systems do not recognize chiropractors as doctors, the Texas Labor Code does. So chiropractors are fully recognized as doctors within the workers' compensation system and can serve as treating doctors. So we've defined what each role is. Now let's dive into the responsibilities as outlined in the Texas Administrative Code Rule 180.22. All healthcare providers in Texas workers' compensation system must adhere to our rules, statutes, and policies that guide the system while providing the high-quality medical treatment that we expect in Texas. And this includes things like reporting required information, disclosing financial interest, and providing fair, unbiased evaluations of injured employees' conditions. And their medical opinions are vital to ensuring injured employees get the care they need when they need it. Providers are expected to evaluate each case impartially and without bias, as well as use treatment guidelines and have honest, important conversations with employees about their care, such as setting expectations for recovering from their injury and helping them make the decision to return to work when it's medically appropriate. And this is to maintain the integrity and effectiveness of the workers' compensation system. Healthcare providers also need to make sure that they're billing correctly by following the medical billing and fee guidelines outlined in Chapter 134 of the Texas Administrative Code. And that generally follows Medicare billing and coding guidelines. And one key task for healthcare providers is to examine the injured employee to determine when they've reached maximum medical improvement. Maximum medical improvement means the injured employee is as good as they are going to get from the injury. They've reached maximum recovery from the injury. For some employees, this means a full recovery, but others may not get back to that 100% pre-injury status. And usually claims have the date of MMI documented, and if there's any lasting damage or harm to the person's body, then an impairment rating can be assessed. The impairment rating is a percentage that reflects the permanent impairment of the whole body resulting from the injury. And healthcare providers also need to comply with federal guidelines and regulations such as the Americans with Disabilities Act to ensure that they're meeting legal requirements while providing the best possible care for injured employees. The responsibilities of treating doctors, referral doctors, and consulting doctors all center around providing the care that is reasonably necessary to treat workers' compensation injuries. And this means that their job is to ensure treatment cures or relieves the effects of that injury. It promotes the injured employee's recovery and enhances their ability to return to work in a productive role. So helping them make that decision to return to work is extremely important. Treating doctors, you really need to work with the employer to understand the physical duties of this person's job and set the expectations for recovery with the injured employee. We want them to help that injured employee get back to work by understanding what they can do safely. Injured employees are entitled to all necessary health care for the duration of their claim. So there's no cutoff of medical services even after the employee reaches maximum medical improvement, as long as that treatment is reasonable and necessary. And now that we've gone over the general responsibilities of providers, let's focus on the role of the treating doctor. And we'll take a closer look at their specific responsibilities within the Texas workers' compensation system and what sets their role apart from others. Injured employees have the right to choose their treating doctor. Usually, the first doctor who provides care becomes the treating doctor. For network claims, unless it's an emergency, injured employees must select from the network panel of contracted doctors, and those panels may or may not include chiropractors. So if you want more information about the process of choosing a treating doctor, you can refer to Texas Administrative Code Section 126.9. Now, there are some exceptions to an injured employee's choice of treating doctor. For example, if a doctor is paid by the employer or recommended by the carrier or employer, this may affect their choice. However, if the injured employee receives treatment from a recommended doctor for more than 60 days, that doctor can become their treating doctor. Another exception involves emergency room doctors. So an ER doctor doesn't automatically become the treating doctor unless an injured employee continues to receive care from them beyond the follow-up care needed or related to that emergency room visit. For example, in a rural area, someone might be following up with the emergency room doctor for a fracture that isn't healing correctly. So if an injured employee wants to switch to a new treating doctor and finds a doctor who's willing to serve as their treating doctor, they can request this using the form DWC 53. And this form has to be signed by the new doctor and then submitted to the DWC for approval. And the form can be sent to us in a couple of ways. It can be uploaded into TextComp, it can be faxed, it can be mailed, and once we receive it, the request is reviewed to make sure that it meets the requirements of Rule 126.9, and it should be processed within 10 days. For networks or political subdivisions, entities like counties, sheriff's offices, or school districts, they may direct contract with their healthcare providers or operate like a network. You want to be sure and check with them directly to see if they have their own process or their own form for changing a treating doctor and making that request. The treating doctor is responsible for overseeing the overall care of the injured employee, even if other doctors are involved. If the treating doctor refers the injured employee to a referral doctor, the referral doctor should be communicating back to the treating doctor on a regular basis. The only exception to this is in an emergency situation. The treating doctor should be approving, recommending all of the health care. And again, everything ultimately goes back to the treating doctor to ensure that they're aware of all the treatments and that they can properly coordinate the overall care for the injured employee's compensable injury. Employers or carriers, you should not be directing medical care or requesting medical records, but when it comes to information about returning to work or modified duty, treating doctor, you have an extremely important role. It's the treating doctor's duty to be talking to that injured employee and employer about getting that person back to work as soon as it is medically appropriate, because there's a 50% chance that they're going to return to work at all if they've been off for more than 6 months. So whether it's for that employer or another employer, if they're off for more than 6 months, again, less than a 50% chance of returning to work. So returning to work is important in mitigating the financial as well as the social costs. The treating doctor is responsible for completing the form DWC 73, and this is the work status report. So let's get into some of the details about this form. You can bill for this form. Again, this is the DWC Form 73 Work Status Report using the CPT code 99080 with a modifier 73, and that will receive a reimbursement of $15. While PAs or advanced practice nurses can complete the form under proper delegation, the treating doctor is the one who is still ultimately responsible for the form's accuracy. So the requirement for the 73 form is detailed in Rule 129.5. It's important to note that a work status report isn't required for every visit. If you've been submitting one for every visit, you may have experienced denials from the insurance carrier, and that's because payment is only authorized when the report is actually required. So the work status report form DWC 73 is first needed during the initial examination by a treating doctor or a referral doctor. It's not necessary for an emergency room visit, but once the injured employee visits a non-emergency room treating doctor or a delegated physician assistant or nurse practitioner, the work status report form must be completed, and it is required for that first visit. After that, a new report is only needed if there's a change in the injured employee's work status or if you're making big changes to their activity restrictions. The rule also states that the treating doctor will be required to complete the work status report at the request of the insurance carrier or its agent or the employer if the request is made through the carrier. However, this should not exceed more than one report every 2 weeks, and it needs to be based on the doctor's scheduled appointments with the injured employee. Next, the report of medical evaluation, or DWC Form 69, is an important form in the workers' compensation system to document that maximum medical improvement milestone in the claim. And although it's not used as often as the DWC 73 form, it needs to be completed by the doctor. And again, nurse practitioners and PAs, they don't meet the definition of a doctor. The DWC 69 form is used when the treating doctor needs to determine the maximum medical improvement date for the injured employee. And unlike the DWC Form 73, there's no separate charge for reimbursement for completing the DWC Form 69 because the payment is included in the fee for that examination. When a maximum medical improvement and impairment rating are required, the treating doctor completes this form. And now there's situations where the treating doctor may not be authorized to assign an impairment rating. And in those cases, the treating doctor must first determine if the injured employee has potential for permanent impairment. And if they are certified to conduct the impairment rating, they may assign the impairment rating, or if they're not certified to do impairment ratings, then they need to refer the injured employee out to a doctor who is certified. Texas Administrative Code Section 130.2 has guidelines for this process. And ultimately, it's the treating doctor's responsibility to establish whether the injured employee has reached maximum medical improvement and then determine the next steps regarding the impairment rating, if one is required. So ensuring that the injured employee receives that high-quality, comprehensive care throughout their recovery from the compensable injury is their ultimate responsibility. If the treating doctor determines that an injured employee has no potential for impairment, they can certify maximum medical improvement without special training by completing that DWC Form 69 with the maximum medical improvement date information. In cases involving minor injuries where the injured employee is treated and released and is not receiving temporary income benefits, the treating doctor is not obligated to schedule a maximum medical improvement examination. Also, as of June 1st, 2025, maximum medical improvement examinations for no impairment may be done by telemedicine or telehealth. Instructions for completing the Form DWC 69 associated with maximum medical improvement with impairment rating examination are on the second page of the form. But remember, once an injured employee has been evaluated and reached maximum medical improvement, they are still entitled to all medical benefits for the compensable injury over the life of the claim. When another doctor assigns an impairment rating or certifies maximum medical improvement, they are required to send the DWC Form 69 and any related reports to the treating doctor for review. The treating doctor is not obligated to conduct a separate examination of the injured employee to confirm the maximum medical improvement or impairment rating. Instead, they should use their comprehensive knowledge and understanding of the injured employee's condition to make an informed decision. If the treating doctor disagrees with the other doctor's assessment, they must provide a detailed explanation for their reasoning to both the division and with the injured employee within 7 days of receiving the report of medical evaluation form. And this ensures transparency and clarity in the evaluation process. If there is a dispute and a designated doctor is requested to give their opinion about the date of maximum medical improvement, impairment rating, or other issues related to an injured employee's compensable injury, the treating doctor has an important role to play. The treating doctor is responsible for sending all relevant medical records to the designated doctor to ensure that they have everything that they need for a thorough evaluation. In workers' compensation cases, this can be done without a signed release from the injured employee, as these cases are generally exempt from HIPAA compliance. The designated doctor is authorized to receive confidential and medical records to help resolve disputes. Along with the records, the treating doctor can include an analysis of the injured employee's medical condition, their functional abilities, and any potential return to work options. And this information helps provide an overview that may aid the designated doctor in their assessment. The treating doctor and insurance carrier must ensure that the designated doctor receives the required records and analysis, if any, no later than 3 working days before the date of the designated doctor examination. This could be an administrative violation if they don't timely provide records to the designated doctor, and it could cause the exam to be rescheduled, which could cause problems for the injured employee. Again, the treating doctor should ensure that the designated doctor receives all of those medical records no later than 3 days prior to the date of the designated doctor exam, as found in Rule 127.10. The treating doctor may bill and be reimbursed for those records from the insurance carrier, and you can find more on that under Rule 134.120 for reimbursement of medical documentation. So there can sometimes be differing opinions about whether an injured employee has reached maximum medical improvement and what their impairment rating should be. In some cases, the insurance carrier might request a designated doctor exam for the injured employee to to help resolve these questions when a treating doctor has not conducted the maximum medical improvement or impairment rating exam. If the injured employee disagrees with the designated doctor's findings, they have the right to seek an alternate certification. This is an option in the instance where a designated doctor's opinion is the first evaluation of maximum medical improvement and impairment rating, and the injured employee isn't satisfied with the designated doctor's findings. So the injured employee can then request an evaluation by their treating doctor or a referral doctor chosen by the treating doctor. So this process gives the injured employee a chance to get a second opinion, ensuring that there's fairness and accuracy in assessing their medical condition, as well as the impairment rating. So the treating doctor can also offer an alternate opinion on various other issues, such as extent of injury or the employee's readiness to return to work. And the criteria for this alternate opinion happens to be the same. If the treating or the referral doctor has not previously given an opinion on the matter, but the designated doctor has, and the injured employee disagrees with that determination, then an alternate opinion can be sought. And this ensures that the injured employee, again, has multiple avenues for fair evaluations, promoting a balanced approach to their care and their recovery from that compensable injury. But the treating doctor has established the care, and they know the history of this injury, and they have established that relationship with the injured employee, and it really is their duty to conduct or facilitate the maximum medical improvement or the impairment rating exam first. If the treating doctor is doing it, the costs of other exams can be prevented, disputes and ongoing delays for the injured employee can be prevented as well. For more detailed information, you can look to Texas Labor Code 408.0041, which covers the procedures and regulations for designated doctor examinations. When there's a dispute about whether a workplace incident caused an injury or condition, the treating doctor may be asked to provide an opinion on causation. Causation is a medical opinion that outlines how and why the claimed accident or incident significantly contributed to the diagnosed condition that's being treated. A thorough causation analysis should include a brief summary of the examining doctor's qualifications, the injured employee's medical history, the exam findings, as well as an explanation of how these findings led to the doctor's conclusion. For more detailed information on causation analysis, you can find comprehensive resources on this topic on the division's website. And you'll see that there's specific information that treating doctors can reference on how to write a causation statement. And treating doctors, please have medical documentation from the very first visit explain the causation or the mechanism of injury, so that if necessary, medical records can resolve any disputes regarding the issue. If the documentation is detailed from the very first visit, treating doctors, you may not have to write additional analyses and disputes can be avoided. If you're a treating doctor, one thing that makes workers' compensation different than private insurance is that workers' compensation insurance is only responsible for paying benefits for the compensable or payable injury. So there can be a great deal of scrutiny surrounding how the injury or illness is work-related. The treating doctor should offer their expert, unbiased medical opinion on whether the diagnosis being treated was actually caused by a work incident or not. And sometimes this involves having a tough conversation with the injured employee about what's part of the work injury and what's not. But again, that's why we rely on the treating doctors for their expert medical opinions. So let's discuss the other types of doctors in the workers' compensation system and their responsibilities. Referral doctors, they're specialists who examine and treat injured employees at the request of the treating doctor. And it's important for the treating doctor to maintain open communication with referral doctors. This ensures coordinated and comprehensive care for the injured employee. Referral doctors, they're going to play a vital role in supplementing the treating doctor's treatment plan, and they should be providing timely and regular updates to the treating doctor, who, again, is ultimately responsible for overseeing all aspects of the injured employee's care. And while there's no official referral form for non-network referrals, if you're dealing with network claims, you want to make sure that you are checking with the specific network guidelines on referrals. And remember that it's important to document the referral in the medical record. The treating doctor must stay informed about the referral doctor's findings and their treatment plans. Additionally, the referral doctor should not refer the injured employee to another specialist without the treating doctor's approval. And this is, again, to ensure a cohesive approach to the injured employee's medical care. A consulting doctor can be brought in by the treating doctor, the designated doctor, or the division. And this is could be to examine the injured employee or review their medical records. And this request is typically made to confirm the diagnosis and ensure the appropriateness of the treatment plan. Consulting doctors can assess the injured employee's medical condition, their work status, and their ability to work, and potential work restrictions as well. While they have the authority to examine the injured employee and suggest other referrals or initiate treatment, they can only do so with the treating doctor's approval. And if the treating doctor approves the request that the consulting doctor provide treatment or health care, the consulting doctor then switches roles and transitions to a referral doctor. And that's going to be taking a more active role in the injured employee's healthcare management. This collaborative approach ensures that the injured employee receives the most accurate and effective care possible in our system. Designated doctors are appointed by the division to provide expert opinions on disputes regarding an injured employee's medical condition. Their assessments are crucial and they can be used in legal proceedings. These doctors undergo specialized training to understand workers' compensation system and how their role affects injured employees. So to become a designated doctor, they must first complete training and testing and apply to be included on the division's official list of designated doctors. And they are required to update their training every 2 years. However, they only need to take and pass the test one time. With recent increases to reimbursement rates for maximum medical improvement and impairment rating evaluations, becoming a designated doctor is now both accessible and more rewarding. Required medical exam doctors are typically chosen by the insurance carrier and in some cases by the division to conduct an impartial evaluation of the injured employee upon request. These evaluations are often sought when there's a dispute or when the insurance carrier wants a second opinion on issues like MMI or the impairment rating or other claim-related issues. Usually, a designated doctor must conduct the initial examination before an RME can be requested. If an RME is requested before a designated doctor exam has happened, the RME doctor can only assess the appropriateness of care if the request is made after an exam by a designated doctor. Then the RME can evaluate maximum medical improvement, impairment rating, disability, and any return to work status, and any other relevant issues related to the claim. The RME doctor does not make referrals or initiate treatment without the treating doctor's approval. And in most cases, the RME doctor is focused on evaluation rather than treatment. So if desired, the treating doctor may attend the RME exam if the injured employee requests that they be there and the treating doctor agrees. And you can find more details about RME examinations in the Texas Administrative Code, Section 126.6. Peer review or utilization review doctors don't conduct in-person exams. Instead, they perform detailed administrative reviews on future, current, or past treatment. And their job is to evaluate the medical necessity and reasonableness of healthcare services, ensuring that the care provided is appropriate and justified. Utilization review doctors review the appropriateness of care, which may occur as part of a utilization review process. And they can also be asked by the insurance carriers to assess other issues not related to medical necessity. To carry out these reviews, utilization review doctors must be licensed in Texas and hold proper credentials. Additionally, they must be registered with the Texas Department of Insurance as part of a recognized utilization review agent. So, let's do a quick recap of what we've covered today. We talked about key definitions related to healthcare provider roles and responsibilities, the basic qualifications for participating in the workers' compensation system, the roles each type of doctor plays in managing the healthcare of injured employees, and the general responsibilities of both doctors and healthcare providers. If you have any questions regarding the topic presented today, medical billing, payment disputes, anything like that, please always reach out to us at CompConnection. Now we're going to transition over to our live Q&A session. Thank you so much for being here today.
Thank you again so much, everyone, for joining us today. We are going to get into answering our questions that we've received so far. Keep adding them. So thank you so much for attending today's CompCourse webinar, and I hope you enjoyed learning about the healthcare provider roles and responsibilities in the Texas workers' compensation system. So just as a reminder, you need to stay through the whole question and answer portion to receive that continuing education credit. And we're going to begin with questions from the Q&A tab. So if you do have additional questions, please put them in there. And I do have Amy Rich joining me today, who will also help answer questions. So we will try to get to all of them. And I'm going to start with question 1. The first question is, how many treating doctors can the patient have? 6, 7? I am thinking that you mean at a time. No, I'm just kidding. They can only have one at a time. But however, if they have good cause to change their treating doctor, then it should go according to the rule. And there's really, our rules don't speak to how many they can or can't have changed to. So I hope that answers your question. And that is Rule 126.9. And let's see here. The next question is, what evaluation groups deal with injured doctors in the state of Texas? And I'm not sure that I quite understand your question. If you have more details, feel free to ask your question again. But maybe the first place I would start if I was an injured doctor and I needed some help, I'd go to the medical association. So let's see. The next question, is it okay for a treating doctor to never examine the patient? And the PA does the documenting and the exams. So there are some situations where the treating doctor may never physically examine the patient. One new change that we had that went into effect last June is telemedicine, and that actually requires that treating doctor examine them at least once. So let's see. Did that one get?
Sorry. Do you mind if I add a little bit more on that one?
Yeah, go ahead, Amy.
So in Texas, we know that there are clinics run by physician assistants and nurse practitioners, and sometimes our injured employees will see them first and last, and the treating doctor never actually sees them. That means if you're licensed in Texas, the first thing is if you're PA or NP, you have to bill under your own bill, your own license number. But the delegating authority is the treating doctor. So the treating doctor for that injured employee would be the delegating authority to those mid-levels, if you want to call them that. So, and then back to the main premise, if the mid-level is conducting the service, they have to bill under their own license number. So I hope that adds a little bit more clarification for things. Now, the treating doctor is ultimately responsible for what the mid-level doesn't do, and the work status report can be filled out by the mid-levels. The report of medical evaluation that determines MMI and IR, the mid-levels may not submit that. They are not qualified to conduct an MMI certification or an impairment rating because they don't meet the definition of doctor. Turn it back to you.
Good deal. The next question is, can a designated doctor recommend a lawyer to a patient? Can they is one question. Should they? That's a totally different question. And our rules don't speak to that. Our rules only talk about, the specific things that a designated doctor should do in their exam. So if you have some concerns about the behavior of the designated doctor, you can file a complaint. Let's see. Anything else on that, Amy?
No, if you have a concern about ethical behavior on the part of any actor in the system, please file a complaint and we'll look into it.
So what happens when the treating doctor refuses to comment on causation or what is compensable? So that's based on the mechanism of injury. So do you want to go ahead and take this one, Amy? I'm going to look ahead at some of these other questions.
Sure.
So that
well,
was...
we provide education to the doctors to have thorough documentation, especially on the first visit, on how the injury happened, what the patient is saying, and the mechanism of injury. Do they always do that? Maybe not, but it is part of the workers' compensation system to only reimburse and only have provide treatment for the compensable injury, right? So you have to, as a carrier, look at all those notes. Now, if you're asking the treating doctor opine, he or she may or may not believe it's part of the injury. We don't know that. We don't say that they always have to side one way or the other. It's their medical expertise. It would be nice if they did participate and opine on that. And I know that that takes time for them to write a causation analysis. You can ask for it, or you can look at the notes. We encourage the doctors to go ahead and document it so they don't have to create another narrative on causation. If they don't, we can't make them. Yeah, we can't make them. That means when the injured employee goes to a BRC or a CCH, they may not have the support or the opinion of the treating doctor. Or maybe even the treating doctor believes it's not part of the injury. So maybe they're just not providing causation at that point because they don't believe it is. It'd be nice if they gave us their opinion one way or the other and had that conversation with the injured employee. That means the injured employee is not going to have the support they need. The Office of Injured Employee Counsel can provide assistance to our injured employees to try and obtain that information. But I don't think there's a mechanism to make a treating doctor provide their opinion on it. Not at this point. Back to you.
Thank you. So should a consulting MD always complete a DWC 73 since they see the claimant less frequently? And this would serve as a means of communication with the treating doctor. So any of the doctors that are filling out that work status report, they can fill it out and send it as often as they want to. But in order to get reimbursed for it, they need to be following the rule.
May I add?
Do you want to add to that? Yeah,
please. Rule 129.5 is the rule for the work status report, and it only calls for the work status report to be filled out by the treating doctor and the referral doctor. It does not mention consulting doctor. So I'm not sure what you mean by consulting doctor, but any doctor that the treating doctor has referred to. That first visit, he or she needs to fill out the 73 and any subsequent changes to the work status or restriction or upon request of the carrier. So consulting doctor is not outlined in 129.5.
Okay. And then how can psychologists obtain referrals to provide mental health services to non-network injured workers when necessary? So like we said throughout the presentation, all of the treatment should be directed by the treating doctor. So that referral would need to come from them. Do you want to add to that, Amy?
It's good enough.
Okay. Next question, if the DWC 69 is completed by anyone other than an MD or DO, is it considered valid? So in that case, the DWC 69, it depends on whether or not they have impairment. So if they do have impairment, it would need to be done by someone who is qualified to do that impairment rating evaluation. And as far as anyone else, well, if they meet the definition of a doctor, that has to be the first thing. So then they have to be qualified if there is permanent impairment.
Yeah, so it's definition of doctor includes more than just MD/DO. So that's found in the statute under definitions 401.011. So it's MD/DO, chiropractor. There's other types of doctors, if you will, under that definition, but PA, physician associate or physician assistant, and advanced nurse, registered nurse practitioners do not meet the definition of doctor. So,
yeah. Awesome. Next question. What recourse do we have as an employer when treating doctors allow employees to reschedule or cancel scheduled appointments? Stay in contact with them, but also before the injury, hopefully you've been following, you have good policies in place on absenteeism. So, I mean, you need to be looking at those, just the same for the injured employee as you would for somebody that's off maybe for a personal surgery or something. But recourse, call the doctor and try to communicate with them. Amy, do you have any tips?
Yeah,
Your wealth of experience and knowledge.
Andrew is speaking to that question, and it disappeared here, but I'm from the employer's perspective for employees. But as a doctor, if you are having a patient that's continually missing appointments for you, there is no charge for missed appointment unless you're a designated doctor. Then you can charge for missed appointments under certain conditions. But as far as a non-compliant patient that doesn't show up for their appointments, I would refer back to Texas Medical Board, your licensing board, on what to do if you need to discharge that patient. So follow your licensing board there on that. But there's no reimbursement for missed appointments in the workers' comp system unless you're a designated doctor.
All right, hopefully that answered your question. Next question is, will you speak to advisement on using a claimant's primary care physician as their treating doctor on a workers' compensation claim? If they're willing to treat that person, I mean, I can speak to it personally. I think it would be good because they know this person, they know their history, they are able to work well with them. There's not any restriction in our rules or anything about that. Do you have anything to add to that, Amy?
I think the key is that doctor has an active medical license, has disclosed financial disclosure to us, doesn't have any restrictions put on by us or their medical board, and they're willing to see the patient for workers' comp, which means they have to bill the workers' comp carrier. So willing, no restrictions, file financial disclosure. There's no credentialing that has to go on unless it's a network injury. That means their employer has chosen a workers' comp plan that's part of a network, which means the injured employee has to choose a doctor from the network panel of doctors. The employer should be letting that patient know or that employee know that they have to choose from this panel. If that PCP is not on that panel, then he risks or she risks non-payment just because she's not contracted with the network. That patient, that injured employee, can ask for special out-of-network approval for that PCP, but it has to be in writing and the network has to agree to it. But they have contracted doctors that that injured employee must see for a network injury. And about 50% of our injuries are network and 50% are non-network, new injuries. Go ahead.
Okay. Thank you for that. Next question is, does a patient have to submit a DWC 53 in order to change their treating doctor? So, or is there an exception? So if you look at Rule 126.9, you will find the rule in there, the exception in there. The first doctor that treats them is going to be their treating doctor. If they're if they're non-network or I believe political subdivision, they need to submit the 53. And then if they're in a network, then they need to, I believe the first change is automatically approved. So anything after that they would need to contact their network to get details about how to go about changing their treating doctor. But again, the whole process is lined out on 126.9, so I would look there. Amy,
Just look at the
anything else on
forms, the
that?
DWC form 53,
good
the
idea.
second page of any form has all the circumstances and rules. So if you go to under F for forms on our A through Z, pull up the 53 and you can read all about it there. But I don't think there's an exception for non-network. They do have to fill out a 53 if they're going to change doctors. And then we approve it or deny it. Depends.
Okay. Next, what recourse does an employer have related to treating doctors who do not forward the 73 to the employer after the completed appointment? Obviously if you know that there is one floating around out there, maybe you could try to get it from the injured employee. You could call the doctor and say, we know this is there, we need it. We're trying to help this person get back to work. We need this form. And apart from that, if it just goes on, you could just file complaints. Amy, do you have any other suggestions?
The insurance carrier can request a 73. So as an employer, you can talk to your insurance carrier rep, and there are several circumstances in which a 73 is required, and that is initial visit, anything changes, and upon request of the insurance carrier. So have the insurance carrier request it, and it has to be on the next
good
scheduled
idea.
visit.
Yes.
So yeah, talk to your insurance carrier and try to get them to prompt the doctor. If all else fails, you can file a complaint.
Yeah. Thanks. Let's see. When multiple DWC 73s are received from one specialist and then another from the treating doctor, which one should be followed? The most current dated one? That's a good question. And actually, we just did a webinar for healthcare providers where we try to address that problem. We want them to not have conflicting 73s, so we definitely encourage them to communicate, and treating doctors should know what's going on with that referral doctor with as far as what they're recommending, any work status changes or restrictions to their abilities. So which one should you follow? That's you should follow the one I believe the one from the treating doctor, but however, they need to be communicating and the treating doctor needs to let you know. Amy, what do you think about this situation?
Well, we hate to see conflicting 73s, right? Because
The
the
worst.
injured
Yeah.
employee will
They're
be
going to suffer.
they're going to be confused too.
Yeah.
So, I guess my advice would be the latest one, but I also would be talking to the treating doctor to say, we need to, you're in charge of all the care for this injured employee. Please talk to the referral doctor that you sent the patient to so we can reconcile this conflict and encourage the treating doctor to do that. So we teach the treating doctors to stay in touch and also the referral doctors to regularly communicate backwards to the treating doctor and resolve any of those conflicts. We don't have any hard and fast rules for that particular scenario, does it say, but let's get them talking. We should all be talking about return to work and resolving any of the conflicts because that could be seen as a barrier for that injured employee to return to a productive role. And that's just really bad for everyone.
For sure. Employers included. If the treating provider refers the injured worker to, okay, if the treating provider refers the injured worker for MMI and IR and it comes back with a high percentage, the carrier obtains a peer review and the impairment rating should be lower. Does the carrier request a DD from DWC? What are the next steps? That we'll come back to that question. Or do you want to go ahead and answer
Well,
that?
sure, the carrier can
For,
request a designated doctor exam to
yeah.
resolve these disputes. So if there are conflicting opinions about MMI-IR, that's what the designated doctor does for this system. And he or she has presumptive weight going into any hearing and dispute over impairment rating or MMI dates. So yeah, a DD designated doctor examination can be requested.
Can a treating doctor be their PCP as well? So we kind of addressed that question earlier. It says that both the primary care doctor and the employee agree, will the DWC approve? Well, again, if they're non-network, they'll have to go through the process to change their treating doctor if they're changing. If they see this person right off, and then if they see this person for 60 days of treatment, then they're going to become their treating doctor. I assume that you were talking about a change of treating doctor since you said, would the division approve of that? So do you hear that question differently, Amy?
I guess the general question is, can a PCP be both? Can they be their primary care and their treating doctor for the injury? And the answer is yes, unless it's a network situation where the treating doctor is not in network, yes. But the treating doctor needs to understand that if the treatment is for the compensable injury, that's one bill. Goes to the workers' comp insurance carrier. Any treatment for ordinary diseases of life and everything else goes to their medical insurance. So that doctor needs to understand to keep it separate. But yeah, I think in theory, yes, the PCP can treat for both primary care and their injury.
Right.
The billing needs to be, separated.
For sure. Yeah. Keep those definitely separated. Awesome. Y'all, it's 3:00 and our time is up. I know this went so fast and we have a lot of questions we didn't get to. So please reach out to us. Thank you so much for joining us today. If we didn't get to your question, you can always reach out to us at Comp Connection. And that number is, let's see if we can post this in chat, I think. No, how can I post this? 1-800-252-7031, or if you just search Comp Connection at TDI, Division of Workers' Compensation, you'll find us. So it's that 800 number, choose option 3. You can also email us at compconnection, all one word, at tdi.texas.gov. And also remember, after this webinar ends, please take that short survey. It's going to pop up on your browser tab when you leave the webinar. And it really means a lot to us. It's going to help us hopefully make these webinars as good as they can be, and also give you the content that you're wanting, that you need. So thank you so much again. And we hope all of you have a fantastic rest of your day. Thanks so much.